Challenging behavior in special education is not simply a matter of compliance or control. It is a signal that a student's environment, instruction, communication demands, or emotional needs may be mismatched with their current capacity. In Week 9, we examine interventions through an academically rigorous lens by connecting theory, practice, and equity. The goal is to replace reactive discipline with preventive, data-informed, and humane support. A foundational concept is crisis prevention and de-escalation. Effective prevention begins long before a crisis occurs. Educators use functional behavior assessment, pattern analysis, and environmental review to identify antecedents, setting events, and maintaining consequences. Visuals can illustrate the ABC model, showing how behavior often emerges from predictable interactions rather than isolated defiance. De-escalation then relies on a calm adult presence, a reduced language load, predictable routines, and the strategic removal of triggers. Animated sequences can demonstrate how tone, proximity, and pacing influence arousal levels and help restore regulation. Behavior intervention plans, or BIPs, translate assessment into action. A strong BIP is not a list of punishments. It is a coordinated plan that defines the target behavior, identifies its function, teaches replacement skills, and specifies reinforcement procedures and crisis responses. In practice, this means pairing academic and social instruction with supports such as visual schedules, self-monitoring tools, structured breaks, and differential reinforcement. The most effective plans are individualized, measurable, and implemented consistently across settings. A useful visual would compare a punitive response model with a function-based intervention model, highlighting the shift from control to instruction. Ethical and legal considerations are central. Special education interventions must respect student dignity, cultural and linguistic context, and the least restrictive environment. Educators must avoid practices that are discriminatory, overly restrictive, or unsupported by data. Legally, interventions must align with IDEA requirements, procedural safeguards, and documentation standards. When behavior becomes dangerous, teams must distinguish between immediate safety procedures and long-term instructional planning. The ethical question is not only, can we intervene, but also, should we, how, and with what safeguards? Ultimately, challenging behavior is best understood as communication under stress. An advanced special educator reads that communication through assessment, collaboration, and reflective practice. When prevention, de-escalation, BIPs, and ethical decision-making are integrated, schools move closer to environments where safety, learning, and belonging are not competing goals, but shared outcomes.